Welcome to Focus on Health. I'm Brenda Teal. We hear the term minimally invasive surgery on TV ads every day for those suffering with back and neck pain. Now, minimally invasive surgery is also an option for fractures associated with osteoporosis. Today, we will speak with a leading orthopedic spine surgeon to learn more on just how far these surgeries have come and the benefits in recovery time and the quality of life patients experience. Joining us now to share his expertise on the subject is Dr. John Milani of Pine Creek Medical Center. Thank you so much for being with us today.
Thank you, Brenda.
Doctor, as I just stated, that we hear the term minimally invasive surgery, but what exactly is minimally invasive?
Minimally invasive surgery usually implies that small incisions are used and that the tissues are treated very carefully, so that, for instance, muscles are not cut through or stripped away from the spine. They're stretched a little bit in order to gain the appropriate access for the surgery.
They're stretched a little bit. Help me understand that.
Yes. As an example, a small needle can be placed through the skin down to the surgical site. A hollow tube can then be placed over that needle, and a successively increasing series of tubes, much like this one that I have here, can be placed. And this simply stretches the muscle apart temporarily. The surgery then can be performed using magnifying lenses or a microscope down through the tube.
So what types of surgeries can be performed with this technique?
Well, the most common surgery is the discectomy. When a patient has terrible leg pain, it's frequently due to a herniated disc. A disc is like a shock absorber or, say, a jelly donut. If the jelly passes through the outer part of the donut, it can hit a nerve, and that causes leg pain, or what patients might call sciatica.
Can you show me what you're talking about here?
I can. If this is an example of a patient who has a herniated disc, say at this level, for instance, and these green areas are the nerves, the disc is pressing on the nerve. The skin incision can be made out here by the skin overlying the surgical site. The tube can be placed down to the spine, and the surgical procedure can then be performed for the tube. Then it's very interesting, when the surgery is completed and you're looking down the tube, you start to pull the tube out and all the tissues lay back down into position.
Really? Now, there are also advancements in treating osteoporosis, fractures associated with osteoporosis.
Yes, that is one of the best minimally invasive accomplishments that's been made to this date. For instance, fractures in the past, especially in elderly patients with soft bones or osteoporosis, were treated with fusion or were treated with weeks or months in a brace. As a model of a vertebral body, or one of the blocks that makes up the spine, if this were fractured, a minimally invasive procedure can now be performed where, using a simple needle technique, needle can be placed down into the fracture on one or both sides. The white globule is an example of the bone cement, orthopedic bone cement, that is then injected. This stabilizes the fracture immediately. The patient is out of bed within an hour or two. The pain, for the most part, in many patients, goes away immediately.
Really?
Yes.
What are the risks involved with a procedure like this?
Very little. The infection risk is negligible when a percutaneous needle procedure is performed. Injury to the nerve, some loss of bone cement into an unwanted area. These are complications, but very uncommon.
What are the advantages?
Advantages that it takes 20 minutes to do. Pain goes away almost immediately. You don't need to wear a brace, and you don't need to do further big surgeries.
Wow, and recovery is faster.
Very fast.
Wow, it's great information for us. Certainly a consideration now for those who are saying, no, I don't think that's the option for me.
Yes, they will be very pleased in most cases with that.
Absolutely. All right. This has been great insight to the advancements in minimally invasive surgery options available today. Together, patients and doctors are able to better make decisions in addressing their neck, back, and now osteoporosis fractures. We want to thank you, Dr. Milani, so much for offering us such wonderful information. If you suffer with any of these symptoms or conditions that Dr. Milani has described, these advanced treatment options may help you regain your freedom from pain. If you'd like to learn more, log on to the website on your screen or call 877-618-8855 today to schedule your appointment. For the first 50 callers who call to schedule an appointment, Dr. Milani will pay for free to the complete x-rays. That's a $150 value.